We all set? Can everybody hear me? Not that they necessarily want to. So, I always joke the Zoom meeting is the ideal situation. You could mute a politician. I mean, how great is that? So, first of all, welcome everyone. Hope you had a wonderful few weeks for our last meeting. I think we're waiting on a few people, but Caitlin, you said we go ahead and we have a quorum. So I think we'll go ahead and quickly start with if anybody got a chance to see and had any comments on the minutes. If you're okay with the minutes, I would love to hear a proposal to accept those in a second.
I move to accept the minutes as presented.
Thank you. Any second, please?
Second.
Thank you, Brian. Great. All in favor, you just say aye or give me a thumbs up either way. Great. Great. Okay, the minutes passed. Then, hey, Verna. Well, by the way, we shamelessly recruited Verna. So she was kind enough.
Happy to help out.
Thank you. Verna was kind enough to join us. I've been repeating myself. I played basketball with Verna's nephew. Long time ago. Just leave it at that. It was in college. So then I think we're going to move on to reports on chairs on the 11/22 WG meeting. And what I thought we'd do is Katie, if you had some reflections on that main meeting, and my sort of takeaway on that was, to be honest with you, my first takeaway is we're going to have to extend the deadline. I think all these different chair groups are really doing great work, but amalgamating all that into core proposals, I think is getting that done in the March timeline is probably unlikely, but that's okay. I mean, we have till the end of June for this legislative session, but my guess is we're probably going to push that out further. We talked about a little bit about prioritizing which group is doing what. I know, for instance, that we had talked about financial incentives and tax credits and all those things, which are just absolutely, in my opinion, critical. That turns out that's not going to be really in our subgroups agenda, which makes sense. I think we have one of the subgroups that actually says finances in its title. So we're going to focus a little more on the workforce, both home and professional workforce. It sounds like all the groups are meeting, incredibly high quality folks. Everybody's putting in the time and effort. I was, pretty excited about it. Like I said, I think it's going to take a little while for everybody to get together. But anyone else who was, was involved in the larger task force meeting, please feel free to chip in with your impressions.
I would just say, Senator, I think perfectly said, and I would agree with you. That was my takeaway from that November 22nd meeting of the Aging in Place Working Group. I did think it was interesting to hear what the other groups are focusing on and working on, and where there's areas of alignment or even duplication. And so we can make sure that we're not working in a silo, that we're working in coordination with the other subgroups, but that we're also not duplicating efforts either, as the Senator said, that there are certain work groups like the one focused on financial barriers that will be working on the financial side of things, which I know is something that this working group, subgroup, had also identified as an issue. So then that way we're not going to be duplicating work across the board. And I think it'll be a good opportunity when we come back together again with the Aging in Place Working Group, as to kind of hear where the other groups are landing on in terms of their recommendations, so that we can, again, stay on track and make sure that we're working in coordination, but that we're also not saying the exact same thing. So I think we've hit a pretty good cadence in terms of the subgroup meetings and the working group meetings, and kind of hit our stride there.
Great. Thanks, Katie. And I should back up a little bit. When we talked about the financing not under our purview, I was talking about tax credits and things of that nature. When we're talking about paying the workforce, that's clearly something that we, it's an unsolvable problem, but we can hopefully make some progress, some progress on it. But I think it's an interesting group, and like I said, I think plugged in, and I am hopeful by the end of this legislative session that we'll have some core proposals that I think can really make a difference.
I do too. I agree.
Yeah, and it's exciting. Was anyone else have any comments on that general meeting? If you were there in attendance, virtual attendance, feel free to chip in.
I would just say, because I've been listening in too, the other thing, and I do think it's probably wise to assume that the deadline may have to be extended, but I do think it's really important to really hone in and focus on, define what the priorities should be, and then really hone in on those top priorities, because there's so much that could be tackled in this whole arena. I mean, and the fact that you have so many different folks that are participating and focusing on so many different angles. And for those of you who don't know me, I work at Easter Seals. I've been with Easter Seals for a number of years now. My colleague, Maggie Webb, is on the task force, and I know Brian, she always says wonderful things about you and your work at the Stipend. My other colleague,
Gotta keep him there.
My other colleague, Nancy Rinaldi, is actually, she really runs our caregiver programs. And I know she also has been listening in. But anyway, but I do think there's so much that could be tackled, that let's not let that be the enemy of like really getting something. That's not, the goal to get everything done be the enemy of just really defining some priorities and making some meaningful steps as we get into the next session. So
a woman after my own heart, and I apologize, Verna, I should have had you introduce yourself. Please forgive me. I just assume everybody knows Verna. So, but Verna, you're exactly right. In fact, we've talked three times in this group about 3 or 4 at the most core things that we can focus on. Why don't we quickly move on to what we thought I'd do is just, and I don't think the results are particularly surprising, but I thought they'd be interesting. Caitlin made the suggestion, and Bernie, you're kind of sending these along. We're going to share the screen real quickly on the Aarp survey that went out earlier this year. And the results, again, aren't terribly surprising, but they do help sort of refocus it and talks about the priority. So
thank you, Senator. So can everybody see the screen?
We can, yes, Caitlin, thank you.
Great. So Verna, I don't know if you wanted to speak on this at all, since you had, sent this to the co-chairs, but I believe this is from the national survey that AARP did. So this is just a snapshot of, the average cost to caregivers. One thing to note is that this figure, 7,242, is just an average, and costs do vary based on the income level of the caregiver, race, gender, and even the characteristics of the person who's receiving the care. So whether or not they have Alzheimer's or dementia or other factors going on. So just wanted to provide that for some context for what family caregivers are facing.
Yeah, and just to verify, this is out of pocket. This does not include potential lost wages or other costs of missing work or those kind of things. This is just strictly paying for things. Is that right?
That's my understanding. Yep.
I think that's the case. So this was, and this is again a shout out to my colleague, because Nancy Rinaldi actually forwarded me both of these studies, and she actually was working on a group with including AARP and the folks at Stipend on a larger project. But this one is based on a national survey. It does not have the Delaware specifics that the other one does. But you're doing a great job, Caitlin, so you keep going.
Oh, thank you.
Well, and again, just real quickly to focus on, I mean, that's a big number. $7,200 is not a trivial number, but that, like I said, is my assumption is that's just the out of pocket. When you talk the opportunity costs, income loss for folks who have to, that number could potentially be even large, significantly larger.
You're absolutely right, Senator. And the next 2 slides kind of speak to that. So I'm going to.
Oh, I'm sorry, jumping ahead.
No, that's okay. So I'm going to jump to slide.
Wendell, I'm on it, man.
Okay, so this slide is showing caregivers' financial security. So, these bars show the percent of caregivers who have had to do any of the following because of their caregiving. So 35% have had to cut back on personal spending. 29% have dipped into their personal savings. 18% reduced how much they saved for their own retirement. 18% also cut back on their own healthcare spending. 12% dipped into their retirement savings. 12% had to take out a loan or borrow money from somebody else. 6% had to resign from their job, and 6% had to retire early. And again, this is all because of their caregiving duties. And then 47% of the people surveyed had to do any one of the following, one or more. So this is just, showing the financial implications of caregiving. And then
And I think what's significant about this, it shows that it is a real financial impact on the economy, because when people are having to retire, when people are having to quit their jobs, obviously they're not continuing to pay taxes. They're not, we often will sometimes worry and will be angsting over the costs of providing the benefits of, to help to the resources that it means to support a caregiver, but we don't always understand the full impact of if we don't provide that help. It really then does still have a larger economic impact.
Yeah, you're taking someone out of the economy. You're taking a portion of someone's economic life out. Absolutely.
And then this slide gets into that even further. I'm going to see if I can scroll a little bit. Okay, so this shows the percent of working caregivers who had to do the following as a result of caregiving. So 29% took paid time off, 28% had to work different hours, 20% took unpaid time off. The next two are pretty interesting to me. 19% worked fewer hours, but then 18% had to work more hours. So some people are cutting back because they need to be there for their loved one. And then some people are working more hours, presumably to cover the cost of the caregiving. And then 10% had to take on an additional job, again, presumably to make more income to deal with the caregiving costs. But 53% of those surveyed had to do any of these that are listed here.
Yeah. Powerful stuff.
So if there aren't any other comments on this survey, we'll jump to the one that is Delaware specific.
Okay.
Okay, scroll down. Oops. Uh-oh.
I did have a question, if anybody knows the answer to this. The 45 plus seemed like a lower number to me. Is the 45 based on, is that when people, statistically start the significant caregiving duties, or is that just, does anybody know where that number came from? Because, usually you're looking at, when you're talking about senior things, a higher number, but is that based on sort of when we assume folks might be doing care for the parents or whatever? Does anybody have any insight on where that number came from?
Yeah, I mean, I can certainly speak to Alzheimer's and dementia caregivers in that a large majority of Alzheimer's and dementia caregivers are in that sort of sandwich generation. So it's those that are providing care to a parent, as well as, may have children at home at the same time. So while there are a number who are providing care to a partner or a spouse who are older, a lot of caregivers, a high majority of caregivers that we find within the Alzheimer's and dementia community do fall within that sandwich generation type of age frame. So 45 plus would be, would fit for the Alzheimer's and dementia community in terms of caregivers.
Right. Well, and I need to get past when you think of caregivers, you think elderly spouse, right? That's sort of the image that comes up, but there's, it's all across the spectrum, different needs. So
I think that's right. And I read through the methodology that the AARP has in the study. It's not specific as to why they chose 45, but Katie, I think that you're right on target. I'm just assuming that's why, because that does, that's the population that is getting into that sandwich generation.
And just to add to that a little bit, I'm in home healthcare, and we see that just not, like Katie, you said, for Alzheimer's and dementia by far, but just for 45 and parents, a lot of people are already located, children are out of state, but these people are needing the care. So it's really not correlated just to being a young age. It's caring for your parents.
Gotcha, regardless of date. Okay, thank you. That's really helpful.
Okay, so I know that Senator Bonini and Katie had mentioned that the other subgroup on financial and legal barriers will probably be looking at financial incentives and tax credits and things like that. But since it was such a big priority, as discussed in our previous meeting, I thought I'd at least share this data. So this survey question had people rate the helpfulness of different resources. And so 63% of respondents said that getting a credit on their income tax for expenses related to caregiving would be either extremely helpful or very helpful. And then I'm not going to read them all because I did email these two surveys out to everybody this morning, but 58% of those surveyed said having paid time off from work to provide care would be helpful. And so the next two slides I'm going to share also kind of speak to that.
Yeah. Oh, I'm sorry, Caitlin, before
Sure.
If we could go back to that one, and I was hoping that the folks on the committee here could help. The second one, information about available resources for caregivers in your community. Especially all the folks who who work in this space. How effective are we at that in Delaware? And this is an unfair question to answer off the bat, but if you think about it, if you don't think we're as effective as we should be, is getting the information out to potential to folks who could potentially use it. What do you think we can do in this building or otherwise to help with that? Because I sort of got the sense when in the larger meetings that there is a fair amount of there's a fair amount of resources that aren't being used, and that it's a part of it is education. So if anybody would like to chip in on that, I think that could be really helpful. Or not.
Brian, I don't need to put you on the spot,
Yeah.
and I can
We're
see you
all-
unmuted,
Right.
so maybe you're going to talk anyway. But I know DSAPID has a project right now, right? To you're having surveying caregivers in Delaware, focus groups on caregivers, and looking to bolster and really improve the services that caregivers provide, which is already fantastic in Delaware. But I'm sure part of that project is how we can get that information out to the family caregivers about what the state is providing and what you're working towards in terms of bolstering those programs.
Yeah, thanks, Katie. So Senator and the working group, we don't have the answer to that question. If we did, we wouldn't do that survey. We've racked our brains over the last few years trying to come up with a better way to get that information out there. We have all the information that they could possibly want, but people are not accessing it as readily as they should be. So we're doing that survey, and that's one of the many questions that the survey asks is, how do we need to speak to you? Where does the information need to be? Do they need more one-on-ones? Do you need to have a personal point of contact to go through things? So when that survey information comes back, hopefully it'll give us some good info that we can act upon. Once we have that, and delineate it, we'll be able to work a little bit better with the people that need the information out there. And I've lost my train of thought. There was one other point. It wasn't the caregiver resource centers that we have. I'm sorry, it might come back to me, but
Please, if it does, jump in, because
if anybody has any input, please, speak up. We'd love to hear it. That's for sure.
Yeah, well, one of the reasons I wanted to go back to the slide is, I mean, if there's things we can do, in our building, and sometimes we have agencies or just members of the public come up and say, hey, we'd like to do X, Y, and Z, and it turns out there's some legal reason they can't, and perhaps we could free up help folks. I will tell you, both in business and in politics, Delaware is very difficult to get the word out on lots of stuff. I'm sure you all live that reality. There's no one set media that everybody reads or listens to. It's a very diffuse media market, so it is tricky. But if and Brian, thank you first of all. But if people, if we come up with ideas that you think we can help with on our end of the business, please let us know.
Yeah.
One
so-
thing, I was just
Yeah,
gonna
was
say,
what I-
one thing you can do, you can get your communications folks on both caucuses working to get that survey out from DSAPID. Because I know you all have been, I know Brian, you all been pushing it, DHSS has been pushing it out, and I think as organizations, we've all been pushing it out, on our different channels. But yeah, like that, it really is trying to get everyone to be invested in getting it out to their contacts and encouraging folks to respond.
That's a great point. And Rebecca, can you make a note of that and we'll share it with the caucuses?
The last point I was going to make, and it's kind of calling ourselves out a little bit. And Katie, thank you for the kind words. I think we do pretty well here, but I believe it was an AARP survey that was done, and this is through our work with advancing states. They mentioned that the lowest score that we have as a state is in terms of providing resource to caregivers. We rank 31st out of the 50 states. It was our lowest ranking. And I think that survey may have been one of the additional pushes that we need, to move forward with this.
Well, that's good. Glad you're working on it. And please let us know what we can do to help. Caitlin, thanks. Sorry, I interrupted you.
Oh, no problem. I mean, this is your subgroup. This is why we're here.
Well, my subgroup. God, let's hope not. It's mine. That's all I'm saying.
Okay, so this next slide again is something that perhaps the finance subgroup will take up, but just for everybody's edification, this survey found that 89% of Delaware residents who took the survey would support providing a state income tax credit to family caregivers who incur caregiving expenses. And Senator Mansavinos actually has already introduced a bill, Senate Bill 143, that would provide a tax credit. As currently written, it would be up to $2,000 or $1,000 per person if you're, married but filing separately. So that has made it out of committee. Presumably, will be worked on once we gavel back in January. But for those of you who are interested in following that bill or advocating for it, it's Senate Bill 143.
Caitlin, did you happen to know what the fiscal note on that was? And I meant to look it up and I did.
Oh, not off the top of my head, but I could look at that once I'm done sharing the screen.
Yeah, that'd be great. And I apologize. I should have asked about that earlier.
No problem. And then 84% of those surveyed would support requiring employers to provide paid family leave for employees who are unpaid caregivers. So there's another relevant bill that's pending in the Senate, Senate Bill 1. It's sponsored by Senator Sarah McBride, and it would create sort of a state paid leave insurance fund. So employers and employees would both be required to contribute to this fund. And then when an employee needed to take time off for any number of reasons, it could be, the birth of a child or caregiving, such as, what we're discussing here, they would be able to tap into that fund. I do know that as currently written, the bill would actually exempt small businesses with fewer than 20 employees from making that payroll contribution. So, but large employers and then all employees would all chip into this fund, kind of similar to how unemployment works. So that is also pending. I know Senator McBride has been having town halls across the state to raise awareness about the bill and how it would work. So that, again, is relevant to, what apparently, the survey says is there's a desire for that. And those were all of the data points that, I wanted to point out. But of course, as I said before, you all have the surveys. So,
Caitlin,
sure.
can you share 9 page, not the slide number 9, because it gets back a little bit to that conversation we were having earlier.
This one?
Yes. So, and I thought this was pretty astounding that 69% of those who have been employed while caregiving had to go to work early, late, or take time off for caregiving. And I just thought that was also very impactful. When you're talking about 69% of those caregivers, they're going to work late, or they're taking off early, or they're having to take time off. It just shows again that, taking a leave of absence, going to part-time, it just shows the kind of impact that those responsibilities have on the person's ability to work. And again, the larger impact that it has on the economy overall. That's all.
Okay.
Good point.
Are you sure there aren't any other slides you want me to share? Oh, you're muted.
You shared the other ones that I had highlighted when I went through it. So
Okay,
but
great.
it is all of it. The fact that it is Delaware based, it was done in Delaware is really helpful. And again, shout out to AARP because Sheila Grant and the folks over there, they're the folks who did this. And I think it's relative this year, the fact that it was done, it's dated March 2021. So it also is really some pretty current, and probably does also reflect some of the impact of COVID, I would say. Which, by the way, we're not through yet. So
You're never ending. Hopefully someday we'll be over it. That's the. So, okay, well, thank you. That's very helpful. And Berna, thank you for bringing that to our attention, and Caitlin putting that together. And then Katie and I, we had a little co-chair meeting. Was that about a week ago?
Yeah, I think it was just about a week ago.
And more importantly, my wife was there because she wanted to talk to you about other things. By the way, folks, you don't know, my wife is very few things in the General Assembly are completely unanimous. One of them is that I totally married up and don't deserve my awesome wife. It's 100% unanimous. I tell that to people and they go, "Oh, you're just saying that." Then they meet her and go, "Yeah, you're right. You don't deserve her." But she is a neurobiologist, Stanford neurobiologist, and has some research programs that do Katie. But we had talked about, and I think Katie, you're gonna, unless I'm mistaken, give us a quick presentation specifically on what some of the other states are doing. And she's gonna reach out to some of her colleagues and folks she knows because she's so well connected about what some other states are doing. Because the reality is, if somebody's doing something that works, let's do it, right? There's no pride of ownership. If something works, let's do it. If something doesn't work, let's not do it. So without further ado, Katie, if you could just give us some of the things you found out and what you think is worth pursuing, and we'll go from there.
Sure, absolutely.
Thank you so much for doing this.
Oh yeah, absolutely. And I regret that I didn't prepare any slides or anything to show you all as I talk, but as a follow-on to this meeting, I'll make sure to get this information out to all of you. And if it's okay, actually, before I get started, I know because I keep looking at you, Bob, and I don't believe you were at our the first meeting of this subgroup. So if it's okay, Senator, can I have Bob take a minute just to introduce himself to the group? And then also Jackie, I know, I believe Brett was attended in your place, but I'm thinking if it's okay, just have you introduce yourselves.
No, thank you so much. And I apologize, a little social faux pas on these group meetings. So I apologize. I didn't ask you guys to introduce yourselves. Please do so. Thanks so much.
Oh, and real quickly, we also have Tommy Morris here on behalf of Cheryl Hikes. So maybe we could add that to the list of intros.
Great. Thanks, Caitlin.
Absolutely. So Bob, why don't you go first? Since you're first in the alphabet.
There we go. Yeah, my name's Bob Byrd. I'm past president of the Home Care Association, also the owner of Home Instead, and I've participated in a number of these work groups and meetings over the years, so I'm pretty familiar with the issues. One thing I would just add is that when we were talking about demographics, most of this caregiving is performed by women. I'm not sure that we were underscoring that.
That's a good point. Thanks, Bob, and we're glad you're here. Jackie, did you want to?
Sure. Yeah, my name's Jackie Wisc. I'm the owner of Shore Care of Delaware. We provide in-home healthcare services throughout the whole state. Primarily, we're considered aid only, so we have CNAs, HHAs, oversight by RNs. And I'm pretty passionate about this. Just to know, I've been on both sides of it as a caregiver, hitting the 45 and younger age, actually, and now also providing care in the home. So I'm seeing a pretty large perspective on it.
All right, well, thrilled to have you. I mean, I think especially those of you who own the businesses and the employers, I'm going to be leaning on you. I think we're going to lean on you for some ideas on how we can help you, get our workforce up and retain. And I apologize, Katie said there was one other person who had not been here earlier.
Yes, Tommy Morris.
Go ahead, Tommy.
Hi, Tommy Morris. I'm just sitting in, listening in for Cheryl Hikes, who is at one of our national conventions. So thank you for having us. We really appreciate it.
Oh, that's great. And you have a cool background. What is that background?
It was in Zoom. It's
Oh,
the
okay.
Enterprise.
Whatever it is. Yeah, whatever. Well, it's cool. It's cool.
Thank you.
And Katie, thank you. I'm not as socially adept at these Zoom meetings as I should be. So thank you for doing that.
Oh yeah, absolutely. Thank you, Senator. So as I mentioned, as Senator Boniti mentioned, I pulled together some information that I was able to gather of ways other states are tackling the caregiver issues, caregiver workforce, family caregiver, impact on family caregivers. And in fact, I found one incredibly helpful resource, and that was the National Governors Association published a report in September just of this year, entitled State Strategies for Sector Growth and Retention of the Direct Care Health Workforce. So I'll be sure to share a link as a follow-on to this meeting to that report itself. But there were a couple of states that I pulled out that I would like to share with all of you today. And then I also gathered some information. This is really, so at the Alzheimer's Association, we track on what states are doing in regards to advancing what we refer to as our state policy priorities, and support for family caregivers is one of our state policy priorities at the Alzheimer's Association. So I have a robust full report of what other states are doing around family caregiver policies, as well as workforce policies. And while these are specific again to Alzheimer's and dementia community, I think that they're applicable really to family caregivers across the board. So let me start. So, what I really did is I looked for, what other states are doing around creating a robust pipeline for the healthcare workforce, around creating incentives and career pathways to recruit and retain professionals in the healthcare workforce, and equip healthcare professionals with the skills that they need to provide competent and person-centered care. So what are some examples of it I found? So some examples of states that are enhancing professional opportunities for direct care workforce really range from creating or strengthening cross-sector planning bodies. So, that could be something we want to look at. I'm not sure if we want to go that route of creating another work group to look at this specific issue, but I know that that's what a number of states have done. They've created working groups that are specific just to enhancing professional opportunities for the healthcare direct care workforce. And others are looking at streamlining training and credentialing and career pathways. So a neighboring state, Maryland, they have what's referred to as Earn Maryland. It's a new state-funded competitive workforce development grant program. Additionally, in addition to Earn Maryland, they also have what they refer to as the Workforce Shortage Student Assistance Grant Program. And this was designed to address workforce supply by providing financial assistance to students who plan to work in certain career occupational programs upon graduation. So again, I can send the links out to all of these programs as a follow-up after this meeting. In New Hampshire, a few years ago, New Hampshire established a commission to evaluate the direct care workforce and preparedness of long-term care and support services for aging adults. So in New Hampshire, this commission conducted listening sessions to solicit public input. And then its final report found that there is significant and growing deficit of direct care workers in long-term care and support services. And in this report in New Hampshire, it was determined that the primary barriers to growing that workforce included inadequate training, low pay, and burdensome caseloads. So they recommended policies promoting volunteer trainers from the retired healthcare workforce and boosting industry competitiveness with neighboring states through reimbursement rate increases. In Wisconsin, in an effort to recruit and retain up to 3,000 additional nursing aides into the workforce, Wisconsin launched the Wisc Caregiver Career Program. And they launched this in a few years ago in 2017. It was developed in partnership with a variety of stakeholders, including the Wisconsin Technical College System. It offers no-cost training and testing to up to 1,000 students through approved nursing home nurse aid training programs, and training to an additional 2,000 students at approved Wisconsin Technical College nurse aid training programs. It also provides $500 retention bonus for nurse aides after 6 months of employment in long-term care. There's also a marketing and recruitment component of this program to increase people entering the caregiving fields, as well as to increase the awareness about the impact that caregivers have on older adults. Wisconsin also had a governor's task force on caregiving that produced a report a couple of years ago. And one of the recommendations was incorporated into the governor's executive budget for 2021 to 2023. And this included a recommendation to develop a person-centered direct support professional training to achieve consistent standards of healthcare practice, as well as career ladder for caregivers, leading to potential certification as a nurse aide. And then in Minnesota, there's a dual training pipeline program, which provides grants and technical assistance to employers to provide a combination of instruction and on-the-job training, an opportunity for direct care workers to earn while they learn. So those are just a couple of examples. Like I said, I'm going to send that report out from the National Governors Association. I pulled most of those from that report, but just a couple of examples. And then in terms of supporting family caregivers, in Maine, there's a pilot program to provide stipends to family caregivers to support their caring for loved ones in the home. A number of states, there's a number of them, and if anyone's interested, I'd be happy to provide the specifics, but there's a number of states that have approved state dollars for state-funded respite care programs. Pennsylvania has what's known as a family caregiver support program, which has expanded access beyond Medicaid to respite and other home and community-based services. And I think that was pretty much, like I said, there's even more information. I would say the majority of what I found is really just, states approving dollars to not only build that more robust pipeline, working with other community stakeholders and partners around career pathway, and then supporting family caregivers through a variety of methods. But I think, again, and I've also seen this too, and we were speaking about it earlier, just building awareness. So I know, for example, in Wisconsin, the state has approved dollars for marketing of their resource programs for caregivers, in addition to what I said about marketing for some of those career pathway opportunities as well. Any questions?
Oh, it's great stuff. Wow, there's lots to get there. First of all, Kate, thank you so much. That's and please send the links around.
Absolutely.
And I wanted to sort of follow up just on a couple of those pieces, and this is more specifically for you folks, when Jackie and Verna and Brian, you the regulatory side of it. One of the things I would like to do in January, February timeframe, this is homework, and I'm sorry, is I want the employers, the ones, and your trainer, the folks who are providing these services, training these employees, trying to retain them. Tell us what specifically you need to do to help us for us to help you get that done. Because if I'm not mistaken, and Brian, I know we talked about this in one of these earlier meetings, retention is a real issue. Obviously, Bernard, we've talked about this for years, paying people enough to get into this and stay into it. But
Yeah, you're not gonna like my answer.
yeah, right. No, and it's the right answer, and we should address that. We've got to figure out a way to do it. But also certification. I know we had Brian a quick conversation about that some of the quote unquote smaller costs up front discourage people, whether it's the background check or some of these other things. But if you guys, and again, it's totally unfair for me to ask this right now, by the way, can you fix that problem? I'll give you 30 seconds. Is if you could put on your thinking caps and let's, think about, hey, here are the 2 or 3 things that we really think would help. And one of the opportunities here for this what I'm hoping for this work group is that we'll have a sort of a direct access to do it. I mean, if we, the idea is to have 3 or 4 things that we're going to push like crazy, and I'm a pain in the neck once I get rolling. So, we're gonna push like crazy. So if you guys could do a little homework and come up with what you think are the core things that we can do at the state government level or other places that you think that we can help with, that we can help you get that done. Because I think the recruitment and retention is beyond critical. When you look at the demographics, we just got to get more people into this business, and we got to retain them, and we got to train them, and we got to have a much larger workforce in the future because we're all getting gray, right? So if you guys wouldn't mind, I'd throw a little homework out there for you, Jackie and Bob and everybody. And nothing's off the table. If you come back, we want to discuss it. And like I said, the goal is to get down to 3 or 4 core things that we can really maybe accomplish. And that's the so Jackie and Bob and Brian, if you guys want to respond to that, you don't have to if you're not, but if you could kindly volunteer to do that homework, that would and get back to us, I think that could be really helpful.
Yeah, well, we can look into it. I can say that on a national level, and Home Instead is the largest provider of these services worldwide, that we are wrestling with all of these issues on a major corporate level. I mean, basically, we're fighting over a labor source that is relatively smaller. There are more and more older folks, and there are fewer and fewer people who fall into the traditional age group that have provided this care in terms of the employees that would provide this care. So we're dealing with some pretty basic fundamental challenges from the get-go. So I think we have to look at it within that context, because we're not the only ones that are competing for this labor source. I mean, if you want to look at the whole, I guess, panoply of issues and sources that are going to be drawing on this, you've really got a very complex network and complex issues. So I think I'll be more than happy to share some broad things with the group, because these are things that we confront on a daily basis.
Right.
We've got all the data. Most of it is proprietary, but I'd be certainly glad to share some of the more salient facts with you guys. And then we can go from there. I mean, I'm thinking back, I've been part of task force where over the last 10 years or so, we've been dealing, and Katie knows this, we've been dealing with a lot of these issues. This stuff is not new.
No.
It's long and it's only been exacerbated by the demographic changes, which we can't control, and the health issues with COVID, which we can't control. So anyway, that's
no. Thank you, Bob, and perhaps we can identify. Here we obviously can't solve all the problems, but maybe that here are 2 or 3 things that are really handicapped us. Here in Delaware, if we could resolve this, it would help.
Yeah, I think
to that level.
Yes, Senator, I agree. I think that one of the things that I was thinking about as we were discussing things earlier is the need to nail down just a couple of key things that we're going to focus on. I mean, I apologize for this is my first meeting, and I probably missed some of the background, but I would benefit from a little more focus on where we want to channel our efforts, because what can happen, and I've seen this happen before, is you get spread all over the place and it gets too thin, and you really, it doesn't work that well. So if we could be a little more precise about specifics in terms of what what our deliverables are expected, then that would be helpful to me.
Well, and I think it'd be helpful to all of us. And I just, politicians are willing to say they don't know. I don't know what those are. And that's why I need you folks to help me. And that's why we try to focus on, if the group can come up with, like I said, those 2 or 3 things from the employer standpoint. Verna, I'm going to ask you to talk about specific policies for respite, for help, because I know that's what you do. And, if there's specific policies that you think we can get that done. And then, I think that's probably like I said, we don't want to get more than 3 or 4. That's probably the 3 or 4 things we want to do. And then of course the big financial questions, which is, how do you pay folks or whatever, we can have that broad discussion as well. But I think, Bob, we're preaching to the choir, exactly right. Let's if we can find those 2 or 3 things that the employers need. Vern, if we can help us with the respite, Allison and everybody else, please chip in on the specific things we need. And if we end up with 12 specific things, but it's okay. We'll pare it down to the 3 or 4 that we think we can get. But I think that's where we want to be. And the goal is that, January, February timeframe, get to those 3 or 4, and then build the actual policies, whether that's legislation, whether that's, regulatory reform, whether that's pushing the JFC and the bond bill to do what they need to do. But that's good. Brian, did you have any sort of, I know you're dealing with these folks all the time. I'm sorry.
Sure.
Go ahead.
That's okay. No, I feel a little bit like a third party here. I'm working as a conduit between the HHAs and the working group. And I don't have the direct knowledge, except that I hear the stories every day, every week, just like Bob had mentioned and Jackie's mentioned. They're the subject matter experts here. What I would like to do is reach out to, we have about 15 personal care and respite contractors, and ask them the question, what's your feedback? And as Bob said, it's going to look pretty much the same. They all have the same exact problems, but the idea is about how to, retain some of the people once they've gotten them. That's the part I'm curious about. That was the problem with one of the failings of one of the HHAs that had tried to do this before, is essentially they educated them. Now they have their certification. Now, where do they go? And the pay is so poor, they realize they got educated and don't want to stick around. It's just not worth it. So where's the ladder at for them? Not everybody has the go-gettedness that wants to go, certification, LPN, RN, and all the way up. And so they get stuck there. So I'd like to ask that question of them and get their feedback. The part that I'm struggling with a little bit is, would this be internal funding to the HHA, meeting that JFC gives funding to home health associations to do certification, to give bonuses for retention for a period of time? Or does this start before someone gets associated with an HHA at a Del Tech level or a college level or something to that effect? I'm not sure that I don't know. The look on your face makes me feel like I didn't say that correct.
No, I think, at least I think I understand it. And I think we don't know whatever
Okay.
most effective.
You're talking about how to build the workforce?
I'm talking about, do they get certifications and become qualified and then become associated with a particular company? Or do they reach out to, say, Home Instead first? Home Instead then already has the funding and they educate them through the ladder.
I can answer that, or sort of answer it. The answer is we have a very robust training program that we've developed at a corporate level and that we require all of our caregivers to go through. There are also a number of programs in the state, CNA programs. The reality is that there are real challenges, and we participated in some of the issues connected with that. The cost of participating is a huge issue for these caregivers. And I got to tell you, this is just my own view, is that the quality of the individual that we get is really a function of, just getting to know the person and understanding what their priorities and life experience has been. We want people that actually care about what they do. And you can't teach that. So a lot of our efforts are trying to recruit people who have an empathy and understanding for others, who have common sense. And believe me, that's our number one priority, because you can have all the training in the world and make stupid decisions, as we all know. So, this is a complex situation. The programs that exist now are just so incapable in terms of the number of people that come out of the, let's say, the CNA programs. It's just so limited that it's really not particularly helpful in terms of our recruiting. So, and I think this is true for a lot of people. In terms of cost, the people that provide this work are very cost sensitive. And many of these folks will leave one job, take another job for the difference of 25 cents an hour. And I think you have to understand the realities. They're living, they have to have the money. It's a weekly thing. If they don't,
They're working 2 jobs just to survive.
if they don't have the additional income, they're not taking that to the Acme. They're not able to, they're really living hand to mouth in a lot of situations. So I think we have to be sensitive to that. This is a huge, complex issue.
Yeah, no question.
So I will just follow up.
Sorry, in the background, my dogs have had a comment.
It's all right.
He's probably the
gotta
most
love dogs.
intelligent, right?
They probably made the most sense today.
Yeah, exactly.
So it gets back to how do you, if you're not paying, if the wage that ultimately that this workforce is going to earn is going to be attractive, how are you going to retain people? How are you going to attract people to go into this line of work if they ultimately know they're still going to be basically poverty line in many cases? Now, that's not always true with some, the nursing. And I realize that I tend to focus right now, of course, on our intellectual disabilities support staff. And we spent years advocating, and we were successful in getting some impact in the reimbursement for the rates for that through the McNesby Act. But, that was just one little sector. That's not, that's just one part of this workforce that we're having to try to retrain. And I got to say, my analogy, it's appropriate to Delaware. The chickens are coming home to roost because we have ignored and kind of put off the attention that the services need, the reimbursement rates. If you're not able to, you're only getting if you're not even getting reimbursed for the full cost of the service, you're not going to be able to pay a competitive wage to this workforce. And Colin, that's that we've had these conversations, and it's a Medicaid match issue in many instances. But if the state isn't willing to step up and spend the money on the service, the federal match isn't gonna help you, right? But we've spent so long not properly reimbursing this service provision, right? So there is no career ladder. And again, how do you build a career ladder unless we're going to show that we're willing, that they're going to be able to actually support their family on this wage? And they are overwhelmingly female, and they are overwhelmingly minority. That's just the reality, and a good chunk at least. And like I said, and that's still only one chunk of this workforce that we're looking at.
I hear you.
Yeah, and Verna, to what you said, just to touch on that real quickly, I have the Sabbath contracts, MCO contracts, private contracts, and a lot of different ones. So I see the whole spectrum on reimbursement rates and how it works. But just again, the workforce situation the way it is now, because there is no backup workforce and we're short. We have so many of our caregivers, and I feel terrible because they're going to get burnout, are working, and overtime is atrocious. It's more than we've seen in the whole, I've been in business almost 13 years, and 13 years I ever saw this. So when you're, and we raised everybody's rates across the board. So you put that in overtime, our reimbursement rates, and then you add your taxes you pay, is almost break even for providers. And that's what's really getting scary. And then yet we need to pay more for retention. So it is, we got to really look at this picture and dissect it.
Yeah, no, good stuff. Wendell, did you have your hand up? I apologize.
No problem, no problem. I was just, the word was just, or someone just brought up the fact that the minorities seem to be affected the most. And AARP just put out a report, well, shortly in September, that 3/4 of the caregivers are reportedly spending their own money on caregiving. Now, this really is not, this is the in-home caregiving. And I'm talking about me caring for my partner, or you caring for your mother or your child. So we're talking around the spectrum here, and I hope we don't lose sight of the fact that caregiving is not only, how do I say this with, I don't mean to be insulting to anyone, but it's not just the professionals but it's us. It's we, the family, that also, and what can this group do to also help this part of the equation?
Yeah, no, it's a fair point, and it's on my little list.
Right.
It's exactly right. But I wanted to sort of, for lack of a better term, leverage the folks here who are in the business, because that's and if you could, guys, put your thinking caps on, and if the answer, Verna, which is more money, I understand that, but let's get some numbers, right? Let's try to figure out what those are. And then also, and this gets a little bit back to what you're talking about, Wendell, is I wanted to have a quick discussion, and I'm sorry, Verna, lean on you, but is to talk about respite care and what policies are out there. And Katie, thank you so much for doing, that was awesome, all that stuff that you found in such a short period of time that other states are doing. But what, if any, policies we can implement to help the respite care for those, Wendell, exactly who you're talking about, because everything I've seen and the feedback from all the groups is that's a huge component to give people a break, right?
Yeah, and if I could add and jump in. Verna, certainly, I think, with Easter seals, respite, you all are the experts on what is needed in terms of respite and how to provide that. And Nancy, I'm not sure if Nancy Rinaldi is on today, but I had the chance to talk with Nancy Rinaldi with Easter seals on Friday. And she is spearheading a respite coalition right now. So I'm also participating along with Nancy on that respite coalition, but I think, having Verna on this working group, this subgroup, and my participation as well on that respite coalition, we certainly can sync up what that coalition is recommending as far as policies that are needed in Delaware to what we're recommending here as part of this subgroup related to respite.
And you're absolutely right, Wendell. I mean, and one of the issues too is if you're to provide respite, you need, again, to find where do you find those people that are able to come in to give the family member a break, and we have a little, one of the suggestions you had was like a respite, kind of like stipends. We have a little stipend program at Easter Seals based on what grants we can find to fund it, where families can apply to get, some dollars to pay another person to come in, but it's a little program. But, again, it's like, you still got to be able to find that person, right? I mean, we were in the home care, Easter Seals, we tried to launch a home care business a few years ago, and we eventually decided we couldn't do it. We just couldn't manage the losses because we couldn't retain the people, and you can get some of our, we could get some of our staff, our that works with our population in the building to also do some of that. But then they're burning their candle on both ends. But you're absolutely right, Wendell. I mean, we have a attendant care program, but the wages that the family member is getting paid if they qualify for that attendant care program, if they qualify, first off, it's 10, Brian, you could probably tell me 10, 15 an hour for some, again, how are you going to find someone that is gonna be willing to be paid that to, you know, when, with just with the competition that's out there. So obviously, this is an issue I feel very passionate about across the board, whether it's for seniors, whether it's for the intellectual disabilities population, you know, whatever it is, because it is a crisis, and we, you know, we're gonna pay one way or the other. That's the bottom line, I feel.
Yeah, and I
Oh.
think it's important, just, I'm sorry, but like the respite care is an excellent point, and what we really are not focusing on, but I think you do have to consider, as when you have family members, be it your spouse, mother, father, whatever it could be, when they're doing their job themselves 24/7, you're not only, it's money out of their pocket because their
Yeah.
costs for increasing it, but it's also, you have to look at the health of the individual doing it, because I've been experiencing it and I see it in our business that you have someone else's health that's the primary caregiver and their health starts declining, then you have additional costs, whether it be from state funding or just out of their pocket. And then you have two people versus one. So it's, you know, you really have to weigh all sides of this.
You know, it's good stuff.
I would only add that the fundamental issue here is that the current model just does not work and will not work. And because we're just rejiggering things that we've developed and programs that we have. I mean, all that's great, but it's insufficient to deal with the major issues that we have in terms of where society is going and what the needs are going to be. So I think that as an exercise to just keep a real open mind about going beyond what we've traditionally done and trying to refine. And it doesn't mean that we shouldn't try to improve what we've been doing. It just means that in order to find a real solution to this, I think we have to find a different way of approaching it, quite frankly. So I'll just toss that out for the group.
No, it's a fair point. Bob, have you seen anything, you know, even if it's just superficially said, oh, gee, that looks really interesting. Let's research that. I mean, is anybody out there? I mean, I realize at some level, these are,
Well,
just getting older, and the economics are the economics, and when we're pushing Sisyphus, right? We're pushing.
I'll just talk broadly real quickly. If you take what's happened is that you've got a source and then you have a need. And the source has basically been declining, but the need has been increasing. And that delta has created a problem.
Bigger and bigger, yeah.
So how do we narrow that delta? Well, when you're looking at the current programs and solutions, even with refinements, you got to say, it's not going to be enough. It's not going to really do the job. It could help, and there's nothing wrong with, improving things to be helpful, but it's not going to deal with the fundamental issue. And I have been a proponent of saying, well, how can we take what we have and make it more efficient and work better? And there is a lot of work that's being done in the technology area and in communications that may help bridge that gap. And I think that's where the most likely solution is going to be. It's going to be in this, in the sense that, how telephony has improved healthcare in the home for docs. Because now you can have a visit and not have to, call somebody into the examining room. So, if we're able to look at applications, not only from a software standpoint, but also some hardware issues that can help bridge that gap, I think we're into some areas that may prove fruitful. We're doing a lot of work in that area. Most of it I can't share because it's proprietary, but I can certainly share conceptually what we're looking at. And so I'll just toss that out for the group, that I think that there's some fundamentals here that we're not going to fix with rejiggering stuff that we've been doing, even though that's a good idea and we ought to do it. But it's not going to solve the problem, in my view.
That's fair. Good. All right, now that I've assigned everybody homework, and again, we want to get back to, and first of all, Katie, thanks again. Those references, what other states are doing is fantastic. Oh, I'm sorry, Brian. I apologize, Brian. I'm
That's
having
okay.
hands.
And-
Forgive me.
Yeah, I'm not going to beat this thing down. Like we're all going over the same thing. We all have the same mindset here. 2 points I just want to make real quick. And
Okay.
again, I know we all realize this. Right now, if we had additional funding for, just say, personal care, and again, this is for the professional workforce. I understand, Wendell, we also need to work on the other side too. It doesn't solve the problem because we only have a certain pool of people. And if I gave everybody else $4 more an hour, all they're going to go is flock that way and create a problem somewhere else. It has to start at the lowest level, the pre-educated level, to get more people into the workforce. And again, we all know that. I just want to make sure we don't lose sight of that. We have to start at the beginning, not in the middle, not with the people who are already educated, already have the licenses. Maybe we'll be able to bring a few back, a few that went to get the $500 or the $1,000 bonus from McDonald's. Maybe they'll come back when we make it, the correct rate for them. But let's not lose sight that we have to regrow the workforce, not fix the workforce that we already have. One other point that someone had briefly mentioned earlier about leveraging Medicaid funding. We're DSAPD, the Division of Aging and Physical Disability that I work for, and all of you, obviously, is going through a reorganization where a small portion of that will be attempting to leverage Medicaid dollars better, wherein we get people who are supposed to be supported by Medicaid on Medicaid. Right now, we skip that step a little bit in the ease of having Title III or general fund dollars and supporting them that way, but that's 100% on our state. Whereas if we get them on Medicaid, we can leverage 50%, heck, 60% this past year with FMAP by getting them on Medicaid. So that's part of what we're attempting to do. Again, that's a small portion of the state, but we'll look for your support as we move forward in doing that over the next 2 years.
No, that's
Yeah,
that's exactly the kind
The
of.
Division of Developmental Disabilities went through that same process. As you probably know, Brian, in the last 3 or 4 years, when they got getting everyone on the lifespan waiver. And they was specifically so that we were spending less state dollars and we were able to leverage higher federal dollars. So that's an excellent move by DSAPD. Absolutely.
Yeah, and it's there. We just haven't pushed hard enough for it because, our providers, they lean on us a little bit. We're a little bit easier to work with Medicaid, but we've got great Medicaid partners now that are behind us and willing to do whatever they need to support us. Senator Benini, if I can,
No,
one more,
please,
because we
Colin
got
is so much better.
way earlier, we were talking about doing a survey that Katie had mentioned. We do have out there with the NASHB grant. I'm sorry, I don't know, National Academy of, I don't know, something or the other. That we are doing one-on-ones with caregivers. We've got 91 of them lined up. I didn't bring it up earlier because I thought it was closed out. It's not closed out. So if I can, later I'll share the link with Caitlin, if I can, and she can share it with all of you.
Oh,
That
that'd
if
be
you
great.
have caregivers that want to participate in the one-on-one survey regarding caregiving and what they need and how to be supported and how to get the information, I would love that. So thank you.
No, Brian, thank you. Thanks, tremendous. So I have been calling on certain people. I mean, it's Allison, other folks who aren't necessarily on my screen. Please feel free to pitch in. I've been focusing on folks I get to see on the screen. So if anybody else has any comments, I'd love to hear from you. Not just me. We'd all love to hear from you. More importantly, we'd all love to hear from you. So, yep. Okay. So I think. So just to sort of recap and just so I have it for my mind and hopefully help other folks. Those of you who are out there in the sort of the employer business owning or regulating side, you're going to do a little homework and get back to us on some, and Bob, understanding we're not going to solve, that there's greater issues, but at least initially, here are 2 or 3 things that we think we could do to really help grease the wheels and maybe get it done. Verna, we're going to dump respite on you, but please reach out to us on how else to get that done. And Wendell, thank you, making sure that we don't forget and we just don't spend all our time exclusively on the commercial side. I think the respite care is incredibly important there. And I know AARP, and when we had talked about this before, and I followed up and I couldn't find the notes from 5 or 6 years ago. As Rebecca, who's on this call, will tell you, she's not surprised that I couldn't find notes. But one piece for the home care that I thought we might get into the final 3 or 4 was scope of practice that folks can do at home and be trained to do at home, where as opposed to having nursing or other folks come in professionally. And I know that had been sort of turned into a little bit of a turf battle, but I thought that was a really interesting, and there was some real hard data that showed that could be really helpful to folks. It was something that when we asked them about it, they said, yeah, if someone could train me to do that, and we wouldn't have to rely on someone else and waiting and feel like we're inconvenienced, et cetera. So if you wouldn't mind reaching out on that. And again, I apologize, I had notes on it and I can't find it, but I think that was something that was, it was simply a policy thing that I thought could be helpful. So that would be great. And then
I will.
Thank you. And Katie, thanks so much. There were so many great things there, and you're going to send out links to everybody. And that's great. And I actually wrote down a couple of those that maybe you and I can talk about. I think what Wisconsin's doing was really interesting, that they clearly made a decision that this is going to be something that they're going to focus on. And I just thought that was really interesting. Maybe that's a way for us to start bringing more attention. So, and then Verna, if you and I at some point get an off conversation too, specifically about what the finances are behind the respite piece, that would be really helpful. And then just real quickly before we move to public comment, if anybody on the committee has anything else. By the way, very helpful conversation. I think we're really moving in a really good direction. So, and by the way, there is no ego to bruise here. So if you guys think we're not moving in the right direction, and Bob, what you said is it's focus. Exactly right. Please do not hesitate. So just going to open it up real quick. If anybody else has any comments before we go to public comment. Okay. Don't see anybody. So Caitlin, how do we do the public comment?
Sure. So we have one member of the public, although I think Katie mentioned her, Nancy Rinaldi. Am I pronouncing that correctly? So Nancy, if you would like to give comments, please raise your hand with the Zoom button and I'll unmute you.
I told Nancy she really is the one who needs to be on this rather than me, and she's going to be the one that I'm going to go to say, okay, Nancy, this is our homework. Well, let's work on this.
We'll recruit her too. There's no escaping.
Okay, so I haven't seen her hand go up, which is perfectly fine. Senator and Katie, I wanted to ask you, would you like me to send a doodle poll out to schedule the next subgroup meeting?
That would be great. And my guess is it's probably a January thing with the Christmas coming and everything, but yeah, that would be great. That would be great.
Yeah, I'll do that. I'll provide some dates for the first or second week of January. I think the idea is that the full working group will reconvene at the end of January at a date still to be determined. So we'll send out potential dates for early January. And if everybody could just fill that out, that'd be great.
That'd be great. And then in the meantime, everyone, for those the homework assignments, if you could, feel free to get to me or Katie or Caitlin, probably Caitlin, so she can distribute, some, if you have specific ideas. And once again, I gave everybody my mobile 302-270-2428. If you need to get a hold of me or text me, that's a great way to get me. And you say, hey, Senator or Colin, I got this idea. What do you think? Because I think what the value that I can bring is a little bit of knowledge of sort of the financial piece and how sort of the policy stuff happens in this building. And if I can be helpful on that, please feel free to reach out individually. So, but this is a great group, and I think we're going to come up with 3 or 4 things that we can really push, and they're not going to solve the problem, but maybe we get a chance to really make a meaningful impact.
I would just say too, if anyone else wants to have a call, I'm definitely going to be working with Nancy on my staff, on the Easter Seal staff, but to just talk about the respite piece too, because we have certainly especially Nancy, something she's worked on for many years here, but if we'd love to have some input, if we wanted to have a call separately that we could come back to the committee together.
Great, great. Yeah, and like I said, if we could come up with 3 or 4, whether one on respite, one on the career paths. Obviously, this isn't including all the financial piece. One on the specific, needs of the home of the people at home who are taking care of their loved ones, whether that's the training, whether that's the scope of practice, whether whether that's I just have tax them. But if we can come up with those 3 or 4 core things, that would be great. And then, and Brian will lean on you a lot because you're sort of in the mix there. Is if there are things saying, geez, this is a holdup. We could do this, and this. If we didn't get this, let's see if we can get there. Let's see if we can get there. So I'm excited. I think it's going to come together, and I think we're going to have some really great proposals, and we're going to push. Because once we get the things, and then push. The great thing about Delaware is you can get things done, right? It's a fight, and sometimes you got to hurt some feelings. Sometimes you get allies you don't know. But the great thing about Delaware is, a small group of people with good ideas can actually accomplish things here because they're so. So I'm excited about that. And on my and once again, before we head out, I just want to say, Caitlin, thank you, Caitlin. You're wonderful. And she was a first stringer, and she stepped up. She's been fantastic. And then my co-chair, Katie, you are awesome.
Thank you, Senator.
And guys, I really think it's a great group. Everyone, please have a wonderful Christmas. And like I said, if you want to get a hold of me in the meantime, please do so. And if like I said, if we can get those homework assignments done, and I think over the next several meetings, and we should be able to really get down to concrete proposals.
Great.
So thank you, everyone, and please, everyone, have a wonderful Christmas. I was telling Wendell before we got on, we have a kitten, so we only did plastic tree ornaments this year because so we're running a running count. So far, she's knocked down 11. She hasn't knocked down, I think, Cool doesn't yet. Oh, she's